Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on one of the common diseases in women, that is uterine fibroid. So basically this is a benign tumor. In medical field, tumors are extra growths in the body are divided into two. One is malignancy, that is cancer. The next one is non-malignant. This is not cancer, but this is just an extra growth. So these are considered as non-malignant. This is not cancer. This is not so dangerous compared to cancer, and these are benign. These are not malignant ones. So this is uterine fibroids. So when these types of tumors develop in the womb of a woman, then we call it as uterine fibroids. This normally occurs between the ages of 35 years to 45 years, and also there are some specific reasons for it. By the age of 50, so almost 80% of the women will have these uterine fibroids. Maybe it can have symptoms or it may not have symptoms. So it can be both symptomatic and asymptomatic, but 80% of the women, when they reach the age of 50, they will have these fibroids. The most common problem with this disease is, see, in allopathic way of treatment, there is no treatment for this. What they do is, when the fibroid is small, corporate hospitals will say that there is no need to treat for this, go away. Once this becomes big, then you come to us, we will operate. So other than surgery, they don't have this any medicine to cure this disease. That's the reason they say, when it is small, don't take any treatment. When it becomes big, come to us, we will operate you and remove your complete uterus, your ovaries and your fallopian tubules. That is the only option they have. But in homeopathy, so when it is small, you have very good option, so that these will dissolve away with the help of homeopathic medicines, and there is no need for you to go for hysterectomy or any other surgery and all the complications you have. So with homeopathic treatment, you can cure this in early stage. Normally this occurs due to specific reasons. One is obesity and the next one is nulliparity. If the woman is not conceived, or if the woman doesn't have children, or if she has less children, then the chances of getting this disease will increase more. And also late pregnancy. If the pregnancy is late, it is happening in our 30s or 40s, even that women are more prone to have this kind of uterine fibroids. And coming to signs and symptoms, what are the signs and symptoms a woman will have when she has this disease? First one is asymptomatic. Most of the fibroids are asymptomatic. They will be there, but the women will not manifest any of those symptoms. And the common symptoms are menorrhagia. Menorrhagia means increased flow of menses. She can have the menses for long duration. The flow on every day will also increase. This is menorrhagia. And also metrorrhagia. Metrorrhagia means increased frequency of menstruation. The menses becomes irregular. Normally the menses should come around 28 days, but in this women it becomes irregular. It may come below 28 days, after 28 days. It can be irregular. Dysmenorrhea. Normally pain is not the hallmark of uterine fibroids, but some women may have pain. It can be mild pain to severe pain as well. Then coming to the symptoms of pregnancy, the women may become infertile. She is not able to conceive due to blockage of some structures within the uterus, or she can go multiple abortions because there is no space for the fetus to grow. So it will get aborted. And also premature birth, rather than fetus staying for 9 months in the womb, it will come out early as well. And also coming to the pressure symptoms, so as this is a tumor, it can put some pressure on different organs of the body, and based on that you will have different symptoms. When there is pressure on bladder or urinary organs, you will have certain symptoms. First one is polyuria. So the frequency of urination increases. You tend to urinate more often, and there will be urine retention. Urine retention in the sense, once you want the urine, you will have the sensation or full complete amount of urine is not going out of your bladder, so that it gets stagnated in your bladder as well. And also urgency, as once you feel that you have to urinate, you cannot control it, you have to run to your washroom and urinate. This is urgency. Next one is incontinence. Incontinence means involuntary, you will be urinating. Nocturia. Nocturia means the frequency of urination increases at night. Hesitancy. Hesitancy means before passing the urine, you will be taking some time, you will be straining. So that is hesitancy. And slow stream. The urine will not come out at a time. The stream will be slow. It will be thin stream as well. The next one is terminal dribbling. Terminal dribbling means at the end of the urination. So you will tend to urinate 2 or 3 drops after you have completed the urination. That is terminal dribbling. You have the symptoms of dyspnea. When this tumor put pressure on your diaphragm, so you will have difficult breathing, and also constipation. So when the tumors put pressure on your intestine, you may get constipation or you may get dyspepsia. Dyspepsia in the sense there will be indigestion, there will be bloating of abdomen and also other symptoms related to digestion. When these tumors put pressure on your blood vessels, you land into symptoms like varicose veins of your lower limb are dilated, and also you will have edema of the lower limb. So sometimes you will have backache, and also as it is a condition of menorrhagia, you will be losing lot of blood during menses. You can land into anemia, and also because of anemia you will have general weakness or fatigue. These are all the common symptoms you find for uterine fibroids. And coming to the investigation, first investigation and foremost investigation you have to do is ultrasound of abdomen. So in ultrasound of abdomen you will be clearly noticing what is the problem and where is the tumor, whether it is in the uterus or outside of uterus. You will clearly come to observe all these things. And to get more details into the exact damage it has done, you may go for CT scan, and also MRI will be more helpful. And in sometimes what you have to do is you have to do hysteroscopy. You will be inserting a small camera into your uterine cavity and also viewing the inside of the uterine cavity. And next one is laparoscopy. When the tumors grow outside of the uterus, laparoscopy will be helpful. You can insert a small camera through your abdomen into your pelvis, and you can observe the changes or the position of the tumors and other things related to the tumors in that camera. And coming to endometrial biopsy, this is one of the important biopsy. This you do especially when the tumors are growing fast and they have been there for a very long time, and the size of the tumor is increasing enormously, or there are huge tumors. Then you have to go with biopsy. This biopsy is to rule out malignancy. If the tumor is turning into cancer, then it can be ruled out through biopsy. In biopsy, what they do is they will cut the tumor and take the small piece out of the tumor and send it for histopathological examination. Under microscope, it can be determined that whether it is a benign tumor or a malignant tumor, which is cancer. To understand this disease further, you have to have some idea about anatomy, the normal structure of uterus and the parts around the uterus. First one is parts around the uterus. Uterus is a cone-shaped structure which is located in the pelvis of the women. So the important function of the uterus is to bear the children and pregnancy and also deliver the baby. These are the functions of uterus. Basically, it contains three layers. When you take the uterus, it will be cone-shaped and it will have three layers. The innermost layer is endometrium, the middle thick layer is myometrium, and the outermost layer is perimetrium. Basically, it is made up of three layers. The muscular part of the uterus is middle layer, that is myometrium. And there is one more ligament that we call as broad ligament. Broad ligament is one of the important structure. Basically, this is the fold of peritoneum. The peritoneum fold, which encloses uterus, fallopian tubules and ovaries, form a thin sheath in the pelvic cavity. We call this hold of peritoneum as broad ligament. All these uterine structures, uterus, fallopian tubules and ovaries, are held in place by the help of this peritoneal structure, that is broad ligament. Coming to the physiology, the important work of this uterus, fallopian tubules or ovaries is to bear the children and produce the children. And the important hormone responsible for growth of the uterus and health of the uterus is estrogen. This is one of the important hormones. It should be in certain proportion. If you have excess of estrogen, you will have problems, and if there is low amount of estrogen, you will have problems. So there should be certain optimal amount of estrogen produced in your body so that your female system is healthy. Coming to the etiology means reasons. What are the reasons for this uterine fibroids? First one is early menarche. If a girl starts to menstruate at early age, she has more risk of developing uterine fibroids. Obesity is also one of the major reasons for developing uterine fibroids. And coming to nulliparity, if you are married or if you are not married and you don't have children, you are at more risk than compared to the people who have produced children. And coming to delayed onset of menopause, your menopause is delayed. Menopause should happen around 50 years of age or 50 to 55 years of age. If it is delayed, then also you have more chance of getting this uterine fibroids. If you are using hormonal contraceptives for long periods of time, if it is in emergency, if you use 1 or 2 times, that should not be a problem. But you have been using it as a long-term contraceptive method, then you will have more chance of getting this uterine fibroids. Coming to the family history, this is one of the important one. If your first degree relatives have uterine fibroids, you are more prone to get this uterine fibroids. And there are some chromosomes which are responsible for uterine fibroids. There are some chromosomal abnormalities or mutations in the chromosome. These are responsible for producing uterine fibroids. And also, if a woman consumes alcohol in larger quantities, it is also one of the reasons. And taking red meat. Red meat means meat from a mammal. That is, you are taking chicken, you are taking mutton, or you are taking beef, pork. These are all considered as red meat. If you take them more, then you are more prone to get this uterine fibroids. And between the ages of 30 to 40 years, you are more prone to get this disease. And also, depending on the race, to which race you belong, black women are more prone to get uterine fibroids than compared to other races. Being black is one of the risk factors for uterine fibroids. And coming to the pathology, what are the exact changes that will be happening in your body when you have uterine fibroids is pathology. So what exactly happens here is the middle layer in your uterine wall, that is your myometrium. Your myometrium contains muscle cells. One single muscle cell within your uterine wall will undergo rapid multiplication and it becomes a tumor. So this is one of the pathologies. This is a benign tumor. This is not cancerous. It will not grow enormously and causes cancer. If the woman secretes excess of estrogen or excess of progesterone, so if there is accumulation of progesterone and estrogen in your body in excess, this will cause the uterus to produce a tumor. So what are the reasons for this? The first reason is obesity. In obesity, what happens is there will be an enzyme called aromatase enzyme. This enzyme converts androgens into estrogen and progesterone. When you are obese, you will have more amount of this aromatase enzyme is produced in the fat cells. When you have more fat, more amount of aromatase is there, it will convert these androgens into estrogen and progesterone in higher quantities, which are responsible for producing tumors in the uterine wall. And also, even the fibroid itself is the powerhouse of this aromatase enzyme. Even these fibroids have the receptors for estrogen, and also they will produce higher quantities of aromatase enzyme. This will be like a cycle. These fibroids are capable of producing more estrogen and they are capable of absorbing more estrogen, which will lead to the development of tumors within the uterine wall. How can we classify these fibroids? All the fibroids are produced in myometrial layer, that is a middle layer. From there, they will either migrate towards the inside of the cavity of the uterus or they migrate away from the cavity of the uterus. Based on the migration, how they are migrating, these are classified. First one is intramural. Intramural means these are the fibroids that are within the uterine wall. These are not touching the inner layer, that is endometrium, and these are not touching the perimetrium. They will stay in between these two layers within the uterine wall, that is myometrium. This is the first type of fibroids. Coming to the next type of fibroids, if the fibroid is touching the endometrium, so that we call as submucous fibroid. When the fibroid is touching the perimetrium, it is subserous fibroid. Based on the fibroid, whether it is touching endometrium or perimetrium, these can be classified. And coming to the hybrid fibroid, what happens is this fibroid will be touching both endometrium and perimetrium. Then we call it as hybrid fibroid. And there is one more type of fibroid where it completely detaches from the uterus and it will enter into pelvic cavity. That is wandering fibroid or orphan fibroid we call. It completely loses the contact with the uterine wall. This is also known as parasitic fibroid. And coming to the grading of the fibroids are graded from 0 grade to 8th grade based on their position within the endometrium, myometrium and perimetrium. So in relation to this, these are again classified into grade 0 to grade 8. And there are other type of fibroid, that is true broad ligament fibroid and false broad ligament fibroid. True broad ligament fibroid is a fibroid that is originated from the broad ligament, and false or pseudo broad ligament fibroid, it is not originated from the broad ligament, it is originated from the uterus and it completely detaches from the uterus and it is placed on the broad ligament. Basically, it originates from uterus. Then coming to the secondary changes. Secondary changes, once the fibroid has completed its course, so it has to go into next stage. It has to degenerate. Whatever has grown in your body, it has to sink. That we call as degeneration. Even in fibroids, we see various types of degeneration. These are considered as secondary changes. First one is hyaline degeneration. Hyaline degeneration, this is one of the commonest degeneration for the uterine fibroid. Next one is red degeneration. Red degeneration, in this the fibroids become red. This happens mostly during pregnancy and also especially during second trimester. And second trimester means it will be from 3 months to 6 months. That is the second trimester. In this duration, it becomes red degeneration. Coming to the next one, myxomatous degeneration. This is the rare one. No need to discuss anything about it. This is not the commonest degeneration. And coming to the cystic degeneration, this is one of the commonest degeneration. This degeneration happens in the postmenopausal women or perimenopausal women. Postmenopausal, once the woman passes the menopausal age, the degeneration that occurs in the fibroids is cystic degeneration. Coming to the calcareous degeneration, this is one of the degeneration where the fibers become calcified. It becomes like a stone, and it is also called womb stone. It is most commonly seen with the subserous fibroid. Subserous fibroid means the fibroid that is moving away from the uterine wall and it goes and sits in the pelvis as a stone. This we also call as womb stone fibroid. And one of the rare changes that happens in the fibroid is sarcomatous changes. Sarcomatous changes means it becomes cancer, and it is very rare. It is less than 0.01%. And coming to the conventional treatment, conventional treatment is a treatment which you take when you suspect uterine fibroids. You go to the gynecologist or a corporate hospital, any doctor nearby your home is called conventional treatment. This is also called English treatment or Western treatment or allopathic way of treatment. So there are a lot of disadvantages with this treatment. We will look into these disadvantages. First one is they say expectant management. What they mean by expectant management is leave the fibroid as it is and check how it grows. The reason they go for expectant management is they do not have any medicines to control fibroids. That's the reason they say you. So leave it. When it grows, we will come to us, we will operate and we will remove your uterus, we will remove your fallopian tubules, remove your ovaries, so that you will not have any problems. But there are a lot of side effects because of this. So in what situation they recommend expectant management is, first one is there is no symptom. You have the fibroid, okay, accidentally you have discovered the fibroid and there is no symptom. They say that go for expectant management. Even if you have symptoms and you are postmenopausal or perimenopausal, you are around the age of menopause or you are in menopausal stage, they say that don't treat it, leave it as it is. If it becomes big, we will operate it. And the next one is pregnancy. So if you are pregnant and if you have fibroids, they say that don't treat it. But in homeopathy, why to wait for a long time then to grow it and then go for surgery? In homeopathy there are excellent medicines, so that when the fibroid is small, you can use the homeopathic treatment and get it dissolved completely without any side effects. So don't go with the expectant treatment as they suggest. If you have any fibroid, immediately come to the homeopathic doctor. Next, they say that you have to interfere only when you have these problems. First one is when there is torsion. When the fibroid within your uterine cavity, it is rotated and it is causing severe pain or bleeding, they suggest for surgery. And next one is when the fibroid is too large, so they will suggest surgery. And also when the fibroid is growing rapidly, rapidly growing fibroid means cancer. So why are you waiting when the fibroid is small and after some time it grows rapidly or it goes into cancer and then take the surgery? So you have to come to homeopathic doctor immediately when you found fibroid, small fibroid, and get it dissolved. That is the best way for your treatment. And coming to medical management, when do they advise medical management? Medical management is for two things. One is to reduce the size of the tumor and also to reduce the bleeding. So what they do here is they will give hormones, synthetic hormones, or the drugs that will inhibit hormones, or the drugs that will block the hormones. So they will meddle with the hormones artificially and will show you the false results. So this is also full of side effects. What happens here is there will be dependency formation. Because of this, there can be cancerous growth anywhere in your body. That's the reason this treatment is also not good. Best treatment is homeopathy in this as well. And coming to the surgery, when the tumor has grown to a sufficient size and as they don't have any medicines to cure the tumor when it is small, so once the tumor becomes large, they will go for surgery. In that surgery, they will remove complete uterus, they will remove fallopian tubules and also ovaries. Because of this, what happens is ovaries are very important to maintain your bone strength. When these ovaries are removed, especially the late age women or perimenopausal women, your bones become weak and your joints are damaged, and you will be more prone to fractures and also other psychological symptoms because of lack of proper hormones. And also they go for one more procedure, that is uterine artery embolism. In this, what they do is they will insert polyvinyl alcohol into the uterine artery so that the blood supply to the uterus is cut off and the fibroids will die. This is also one of the dangerous procedures. It is not only stopping the blood flow to the tumors, but also it is stopping the blood flow to the complete uterus, and also it has lot of side effects. This is also one of the worst treatment you can take for uterine fibroids from allopathic treatment. The final thing you have to remember here is they don't have treatment for fibroid. They ask you to leave, don't treat it. When it becomes good, when it becomes big, come to us, we will operate and remove everything, which has lot of side effects. So don't believe this. When you have fibroids, come to homeopathy doctor immediately so that your problem will be solved. And coming to the homeopathic treatment, except in few cases, homeopathy will do wonders here. When there is torsion, what are those exceptions? When there is torsion, when the uterine fibroid rotates and there is severe bleeding or severe pain, we advise surgery. Or when it is too large, where we cannot treat it with homeopathic management, and you have a lot of pressure symptoms, so then also we will advise for surgery. Next one is when the tumor is increasing rapidly, it is growing too much, so then also we advise surgery because it may land into cancer. So normally rapidly growing tumor is a sign of the cancer. Except these two cases, any case, whether it is small, whether it is medium, whether it is large, homeopathy treatment is the best. Homeopathy treatment, you can dissolve these completely without any side effects, and it is also very economical compared to any other treatment. Compared to surgery, homeopathic treatment is much economical. In this case, you are not only curing the existing tumors, you can prevent more tumors coming up. Or once you get operated for a tumor, you have the tendency to get again and again, or you have the doubt that it may come again, then also it has homeopathy treatment will act as preventive. In this case, it is not only curing the fibroids, it will prevent the fibroids from coming again and again, and also it will stop the growth of fibroids. It will stop the growth of multiplication of fibroids. If there you have only one fibroid, it will stop it there and it will not lead into multiple fibroids in your uterus. Homeopathy is both curative and also preventive in this case. And what are the precautions you have to take? The important precaution you have to take is, so if the fibroid is increasing in size rapidly, you have to seek out the doctor immediately and check for the biopsy. Next one is, this is bit abnormal here. Normally smoking decreases the risk of fibroid. What happens in smokers is they will inhibit the aromatase enzyme so that estrogen is not produced. There are less fibroids or less serious fibroids in these women. Smoking is protective here. Even though smoking is protective, we will not advise you to smoke. And also having multiple pregnancies and having multiple children is also protective for uterine fibroids. Apart from this, take healthy diet, take low carbohydrate diet, exercise regularly, and lead a stress-free life. And also one more important thing is, you have to sleep 7 to 9 hours per day, so that if you have fibroids, it is very easy to cure them, and also it will prevent the fibroids from occurring. And coming to the prognosis, what happens if you don't treat fibroids? The simple fibroids will become complex. Sometimes rarely they become cancerous. You may land into infertility. You are not able to produce children. Even the produced children, there will be premature births. Your child is born much earlier. There may be multiple abortions. These are all the complications. So you may have severe labor pains, and you have to go with LSCS, or there can be twisting and torsion of fibroids, which is an emergency case where there is severe pain, bleeding, and infection as well. Yeah, these are the problems you will land into if you are not treating the fibroids at the earliest. We are Fidicus Homeopathy. We are located in Manikonda, Hyderabad. You can directly come to us physically and take the treatment. And also, online treatment is available wherever you are in this world, or in India, or in Telugu speaking states. We will be calling you and we will be taking the case and sending the medicines to your doorstep. So make use of this opportunity. Thank you.